Now, of course, the holiday season is coming up very soon, and you want to make sure that you are in good health to make sure that you are able to travel, that you're able to spend time with family and friends, and that you are all set and ready to go for the holiday season. Well, of course, you can trust local experts. Everyday or life-changing care. They are here for you when they need you. That is St. Joseph Hospital in Elgin. They're located at 77 North Airlight Street. Offering exceptional care no matter who you are. Check out their website at stjosephelgin.com and check out more information also on their Facebook page. But stay tuned if we got our next interview here. We've got St. Joseph Hospital's Director of Nursing for Emergency Services and Critical Care, Katie, along with their Trauma Coordinator, Chau, with us here in the studio. Thank you both so much for joining us today.
Thank you so much for having us.
You're very welcome. How are you both doing?
Good. We're glad to be here.
Absolutely. Thanks so much for joining us. So, Katie, do a little introduction of yourself and how you got started with St. Joseph Hospital.
Sure. So I am, as Matt said, the director of the Emergency Department, Emergency Medical Services and Critical Care in our Behavioral Health Unit. I've been with St. Joseph Hospital for about 4 years. And I actually, fun fact, worked here 19 years ago also through nursing school. Now I'm back. Yeah. And excited to, I've been excited to be back for 4 years.
That's awesome.
It's amazing.
And then you, yes.
Oh, so I've been in St. Joe's for about 10 years now, working as a trauma nurse coordinator, looking over our trauma services in our hospital, as well as the EDAP coordinator for our hospital.
Very good. So, folks, stay tuned for more here. I wanted to start off by talking a little bit here. I know we've got a lot of different things that we'll talk about, pediatric certification, geriatric ER, and then we'll also discuss a little bit with you folks out there who are tuning in about FastTrackCare. So let's start off with the hospital's emergency room. For listeners who may not have visited before, can you describe what makes St. Joseph Hospital's emergency department unique compared to the others in the area?
Mm-hmm. So we're a local community hospital, kind of with the neighborhood feel to it, I would say. In speaking to patients, we have a lot of loyal patients that have been coming to us. Yesterday, I just talked to a patient who's been coming, for many, many years, was there with another family member. Recently, a lot of feedback we get is our quick emergency room wait times. People are getting in and out. They tell us compared to, in other emergency departments that they visited, they're in and out much more efficiently, quickly, which we pride ourselves on.
That's awesome. That's really great. The emergency room, sometimes it can be, I think for everyone, it's a scary experience, especially when you go to the emergency room. You don't really know what's going to happen. And so when you have that care and when you have a space that feels safe, that's very important for people to be able to feel that and not feel like it's something that's too scary. I think that's important.
Sure. And I think that's one of the things that we really pride ourselves on is our ability to be approachable, to be in touch with our patients. And in fact, we rank in the 90th percentile for our doctor and nurses communication and relating to our patients.
That's awesome. So tell us a little bit more on just some more like maybe examples or some things that your team does to ensure patients are seen quickly, receive the right level of care, especially during those peak hours too.
So our team is very collaborative. It starts at the registration process. Our registration is streamlined to get patients back. They work with our nursing team to kind of triage, see, what needs to come back first, what can wait a little bit. And then it immediately starts with our registration team, with our nursing care team, along with our patient care techs that help support our nurses and physicians really greatly. We get the patients back and just constant communication. Even the layout of the emergency department is a kind of open concept, able to communicate with our partners, able to communicate with each other. Our radiology department is right next door, getting people back there quickly and then, return to the emergency department. So I would say really probably the layout of that constant open communication, able to just lean on one another constantly.
Yeah, you definitely need that. You got to have a lot of staff. You got to have people, working together, and coordinating with each other is very important too. What are some things that ER staff can face at times? How do you work together to overcome maybe some challenges at times?
I mean, I don't think it's talked about regularly. All of healthcare is struggling with staffing challenges, for a multitude of reasons. So we do have staffing challenges, but we're constantly trying to stay ahead of the game. We work with our HR partners all the time to stay ahead of recruiting. And then we have a pretty quick onboarding process to get people up and going. Our orientation is we have a educator specific to the emergency department that helps drive our orientation, helps keep it efficient, helps ensure that new staff gets the best orientation possible, to help the staffing challenges. So while we have staffing challenges, we're always trying to be, we're one step ahead to counter those. I would say another challenge is, again, as with any emergency department, it's fast paced. It can be unpredictable at times, which is what ER staff loves. I mean,
It's what you're trained for.
Yes, correct. We're trained for it. We love it. We love the adrenaline that comes with it. It can be challenging at times, but it's like you said, it's what we're trained for, I would say.
Yeah, we certainly appreciate that fast-paced nature of our department. But one of the things that we've always strived to achieve is the safety in our department and how we work with our security staff and our internal policies and procedures in order to maintain safety for our staff and safety for our patients while they're in the ED.
Absolutely. And security staff is important too. There's usually for emergency rooms, there's a certain time where, you have to go through security, and especially I think maybe later at night. I know it kind of depends on the particular hospital, but I know
I agree with you, Matt. And times are changing, and it's a cultural change. And there have been incidences across our state, our great state of Illinois, where there have been some security issues and injuries that occurred from staff to staff, from patients and to patients. So security paramount in our department. We take it seriously, and it's something that we pride ourselves in making sure that our staff and our patients are safe at all times.
Absolutely. That's fantastic. On to the next thing. We've got some we're going to start with pediatric certification. We'll move on to this next one. So explain a little bit what it means for St. Joseph Hospital to be a pediatric certified emergency department.
So our ED is an emergency department approved for pediatrics by the Illinois Department of Public Health. It's an incredible designation, very difficult to attain. It ensures that our staff and our providers have been appropriately trained in order to treat the critically ill and critically injured pediatric population.
Okay, very good. How does this certification impact the care children receive when they come to your ER?
So like I said, it really just speaks to the abilities of our physicians as well as our nurses in order to appropriately care for the pediatric population. They are a vulnerable population. They need specific care tailored to them. So it's important for all of our staff to be attuned to that and to get annual education and be abreast on all the new changes that are coming along with pediatric care.
Absolutely. And there's always going to be new forms of training that's involved as well when something new arises also.
Absolutely. Medicine is changing, and we see that every day. We use evidence-based medicine. We stay on top of that, knowing the newest and latest care for our pediatric population. We also do the basics, which is maintaining our PAL certification, EMPC certifications for our nurses, and as well as for our physicians.
Now, there might be times, too, when maybe someone comes up to you and asks you a question that might not be in your particular realm. You usually have to direct them to a specific other person who will be able to answer that question.
Matt, can you clarify what questions that might be?
I'm
sorry.
No, that's okay. It's generally it's just a statement as like whenever, I'm sure there's been times when people might ask you a question and it's like, that's not specifically my specialty, or how do you go about with that?
So I think what you're trying to say, Matt, is that we currently do not have an inpatient pediatric unit, and we do not have pediatricians who work in the emergency department at St. Joe's. Is that what you're
Yes.
asking?
Sorry. Yeah.
So we work very closely with Lurie Children's downtown in order to consult those difficult cases in the critically injured and critically ill pediatric population. We have very close communication with them, as well as they're utilizing their transport team and their subspecialists down at Lurie's in order to accommodate those really difficult pediatric patients.
Very good. Again, it just shows everyone working together in the community together is great.
And that's what I was going to say also. I think even locally in the hospital, we all, I know Chau's specialty, she knows my specialty. We kind of just all lean on one another. We also do have a, Prime Healthcare as a whole is a big company. And so we have other resources, that we can even lean on from that for any specialty, not just pediatrics, that we can always seek out, other opinions, how are you doing this? What have you had the best experience with?
Yeah, that's great. I love seeing that when different departments are able to lean on each other in that way.
Yeah.
You might learn something new and they might learn something from you and communicating when something new arises that everyone knows about it too.
Yeah.
So very good. Next one here we want to talk about is geriatric ER accreditation. Many of our listeners may have aging parents or grandparents that are out there. Many of you I know do. What does it mean to have geriatric ER accreditation? Why is it important?
So, this is a new accreditation, brand new for us. It's through the American College of Emergency Physicians. And it kind of it sets us apart. We have, similar to the pediatric accreditation, we have nursing staff and physician staff that have completed specialty education, specialty certifications to the geriatric patient. They kind of help educate the rest of going back to what we were talking about, help educate the rest of the emergency department, both physicians and nursing staff. We also we monitor certain metrics or certain, quality measures to make sure that we are exceeding, that we are staying, in the best possible practice and care for the geriatric patient. We have care, we're kind of more in tune to the geriatric population, to certain, even specific to some of the food options that we offer. We are more tailored to geriatric population. We have an abundance of mobility aids and safety things that we can send with geriatric patients specific to that population.
That's good. Very good. So you've got a lot of different resources. There are certain design features. So what are some of the design features that does your ER have to serve older patients?
So kind of, again, the layout, we have, certain patients, especially the older adult population, are more prone to falls, and they're more prone to falls with injury. They might get it, if you or I fall, we might not get injured as much as an elderly person might get injured. So the layout of how we can place our patients, how we can provide that nursing care, being right there, whether it be a nurse, a patient care technician. Again, that collaborative, if they come in, they are super sick, we have the physicians right there that we can easily adapt to, transporting them throughout the hospital for any testing. It's close by, it's easy to do, it's easier, it's efficient to do.
Mm-hmm. Absolutely. And again, this is an accreditation that I think maybe has changed certain approaches as time goes by, again, with technology growing and everything as well, too. So,
Sure, Matt, I have to agree. I think the geriatric population is a complex population. They have a multitude of medical problems in addition to mobility issues, and we are very thoughtful and very attuned, especially with the new education that we're receiving for that geriatric population in the emergency department.
I think that's something else that we've kind of collaborated with our physical and occupational therapy partners and speech therapy even. They're more down in our emergency department. They're seeing patients efficiently. They're seeing, making sure they are safe to go home, or is there a different, opportunity to ensure their safety?
Yeah, that's very important. Let's talk a little bit about the new FastTrackCare services. What is this new FastTrackCare service? What types of cases or patients it's designed for? So we'll just kind of talk a little bit first on what it is.
Sure. So FastTrack it's a new technology for us that we've recently adopted. It allows patients to go online and basically make an appointment to come into the ER. There's time slots that are available that they can sign up for, a certain amount each hour. Yes, thank you for pulling up. Certain time slots that are available each hour, and they kind of fluctuate depending on our busier times, allowing the patient to streamline getting in. Obviously, it is for non-life-threatening emergencies,
No limb threats.
yes, for any life-threatening emergencies, please do call 911. But it allows you, it allows the patient, so it's very user-friendly. I went in and tested it myself. You can access it from our website. As Matt just showed, there's a QR code. You can go to the website. It brings you right to the website. It's not very labor-intensive to, put your information in.
Yep.
It gives you the time slots of where, so you can kind of, even if it's something that is, like I said, not life-threatening, you're at work, you want to come in, you can kind of plan your day around it. It alerts our registration staff and nursing staff, so then we can prioritize when that patient gets there. Our nursing staff also works with our physician or, our PA that's there to make sure that the patient gets in efficiently, gets registered. It basically jumpstarts the registration process also to get one step ahead.
It's great to have that access available for anyone too. It makes people feel a little bit more comfortable. It's like, it makes people feel like, okay, I'm able to have this to help me out. And I think what's also great too is when I looked at it as well, when I was compiling these questions, I was like, this is actually really easy to use, especially for folks who maybe are not as tech savvy.
Yeah, I think it is very user friendly. And I think going back to what you said at the beginning in the interview, coming to the hospital is scary for somebody. It's scary. It's coming to the emergency room, especially if you've never been there, if it's your first time. And this helps give a little bit of control back to the patient. When they can come, they can, prepare for it.
That's great. I mean, some of the features here I'm reading: enhanced access to same-day care for patients, capability for ER staffing, ER staff to instant chat. That's another thing too. That instant chat is great to have there. Improved awareness for ED teams specific to patients coming in via FastTrackCare appointments. So, and folks, if you're watching here on YouTube, I've got it posted up on the screen. I'll also send you a link in the description once we post this on YouTube for you to access this as well, for you to check out this information. Again, FastTrackCare, it's very easy to use. And it's very straightforward, which is exactly what it's supposed to be. Straightforward. Let us know when you're coming in for an appointment, and I'm glad that we were able to touch base on this today. So I'm very glad I'm glad that this is something that is something new. I'm sure. Have you received any kind of feedback already from folks?
Yeah, like I said, it just gets them one step ahead in the registration process. It gets them one step ahead to get the ball rolling. Nobody wants to come to the ER. Everybody hears horror stories of coming to the ER. It's going to be a long wait. It's going to be, you're going to have to wait for this and then that. And, you may not be seen, whatever. And so it helps. It's that one step ahead and gives the patient reassurance that you're not going to be there that long. You're not going to be waiting as long as you potentially could.
Absolutely.
Not only that, but I also want to touch on the point that you're getting the full functionality of an emergency department, not an urgent care, an emergency department. So if you need an emergent CT, if you need an emergent MRI, if you need an emergent ultrasound, that all can be done while you're in the emergency department, where really you wouldn't be able to do that at a convenient care center. It gives our community access to the best healthcare and most up-to-date healthcare at ease, at their fingertips, really. So I love this new program. It has been a huge patient satisfier. I also want to say that it makes it just incredibly accessible. Like to Katie's point, I can't emphasize that enough. It really takes the scare or the boo away from coming into the emergency department. That you are coming there. We're hand selecting sometimes where the emergency department is not at its busiest, so you're not waiting an incredibly long time to see a licensed provider. So I think, like you said, it just is a great service to the community. It really reaches out and says, hey, we know that there are people who need care, who may be a little bit afraid to come into the emergency department, but they absolutely need to be there. So yeah, I think it's great. I'm excited for it. I'm excited to see long-term how that impacts our community.
And it helps to show that people are in good care. They're in good hands.
Right.
Yeah, it amplifies that. So that's fantastic. We only have a couple minutes left. Let's move into our final segment here. Improved wait times and patient satisfaction. We've heard that St. Joseph Hospital has significantly reduced ER wait times. How were you able to achieve that improvement?
So FastTrack helps with that. Utilizing FastTrack, again, it helps both the patient be more efficient as well as the nursing staff, registration staff, everybody. We can kind of plan. As I said, the emergency department can be unpredictable. That helps it be a little bit more predictable, which helps wait times. And again, the collaborative nature, I would say, of the staff, how they work together closely with registration. The registration process has become more efficient. We've worked closely with them, our IT team, to help and just increase the efficiency in registration. And then back to nurses bringing, when a patient first sees a nurse, getting them back there to the right level of care, communicating, kind of triaging what to do first, what to do next, whatever. I would say, and it is when going back to patient satisfaction, we have a robust rounding that all nurses are rounding, and in the ER, they all kind of know what's going on with every patient. It might not be their patient, but just helping, one nurse will help discharge. If Chau as a patient, I would help discharge Chau's patient because Chau's busy. And so that helps get the next patient back to help decrease wait times. We do have, like I said, robust rounding where we as leaders are regularly rounding on patients. We are seeking feedback. We are trying to see what are we doing well? What did help you get in? What did help? What could we improve upon?
Awesome. Yeah. Well, we are already out of time. I appreciate both of you joining us today. And of course, folks, check out more information on their website. You can find it at St. Joseph Hospital. You can also find them stjosephmedicalcenter.com. Check out FastTracks. Check out all this information. We'll have this posted on YouTube, so of course you can see it as well. I appreciate both of you taking your time and energy to come in today to help the community out, as always. Thank you so much.
Thank you for having us.
Thank you.
Of course, and thank you for your service as well.
Yes, thank you.
Folks, we'll take a quick time out. We'll be back with more in just a little bit.